as few as one, by the way, we will then examine that we'll go in and examine that company to determine whether they are complying with the consumer protection laws that we have. So, for example, if you were to file a complaint or tell your patient to file a complaint against the company, that's in our books as a complaint against that company based on autism, and if they have a couple of those things, then we'll send a group in, and that's not necessarily a pleasant experience.
We've heard a lot of that on our end, so it's not just, isolated situations. So thank you for bringing that up.
Yeah, but what I would, Tony, at your convenience, if you want to coordinate a meeting, come in and we can talk. We'd like to hear, what's happening on the street, so to speak. That would be helpful to us.
Yeah.
Do states have the right to appeal whatever our Federal Health Reform Act turns out to be? So, for instance, if you're saying that Illinois pretty much is in line right now with what we're seeing federally, but should that tide change or another state be against it, do you expect to see a slowdown on the implementation because states are appealing or fighting against the federal law?
We are not in line with the federal law as proposed, by the way. We would benefit tremendously from the federal law. I think it's unclear politically what's going to happen, although it is likely that the states will have the opportunity to opt out of the national reform. My expectation is that Illinois will not. I would be really surprised if Illinois did not embrace this opportunity. That's my expectation. And the effective date would be 2013. However, there are a number of provisions in the House bill and the Senate bill to protect people like us during the transition period, so that insurance companies aren't able to twist us out of their program between now and the effective date of the reform.
Yeah, I just had kind of based on the ABA comment or question. It seems that there's so few providers out there who are able to give those services that we can effectively, or claims can be effectively denied by going into the provider networks by insurance companies. And do families have any recourse in those cases?
Yeah, this is really interesting to me. As I said, I think what I would, Tony, at your convenience, encourage you to bring, if you want to bring some folks in, and we'd like, the law just passed and became effective last December. And of course, with any regulated industry, they try to build around the regulation. And it's helpful to us to understand what, as I said, is actually happening on the street. So if you are interested, we would love to know. We would love to know what you're hearing from the companies.
If you're correct, and when the dust settles with the healthcare reform, we end up with state-based exchanges. Does that mean that standards are going to vary by state? And
yes.
What does that mean for portability?
Portability in the sense of moving policies across state lines.
Mm-hmm.
Yeah, that's a concept that's received a lot of attention. And if there are state-based exchanges, it does mean that different states will have different standards. I don't think, as the people of Illinois anyway, that's an approach that we want to embrace. I think, speaking for myself, I have a lot of concerns with the idea of someone in Illinois being able to buy a policy that was approved in the state of Alabama, for example. Alabama, they don't have an autism mandate. They don't have a mandate to cover osteoporosis diagnosis and treatment. So understand, this is the idea of selling policies across state lines as being beneficial to consumers is not necessarily that easy. Most companies do sell in multiple states. Aetna, Humana, Cigna, United Healthcare, These companies, they sell in every state. But the difference in cost is, one, providers, of course. Provider reimbursement rates differ from Mobile, Alabama to Edwardsville, Illinois. But the second reason for a difference in cost is what are they required to cover? And I don't think that in the state of Illinois, we want to have the legislature of Alabama decide what's appropriate coverage for the people who live there.
And I had a question about the general education bill. I think it's fabulous what was done by the family. When you have children who have significant health care needs, but they're not exhausted. It could be cerebral palsy, it could be more obscure diagnoses that they have. As much of a need for all the therapies and all the durable medical equipment. How might that fit? Is there a companion bill? Is there any movement toward coverage for broader issues?
Effective January 1st of 2010, it was Senate Bill 101, and it's called the Habilitative Care legislation. And that will, I believe, cover many of the same or similar services, but have a broader diagnosis it covers a broader diagnosis than just autism spectrum.
But will self-insured companies not need to abide by that?
That's right. That's right. Yeah. Although it does cover public self-insured, it does not cover private self-insured. So it would include counties, municipalities, and state plan. Yeah, it is.
So what do these people, what do we do if we're self-insured?
Well, I think that change is coming at the federal level, and as I alluded to that, or described that one provision of the House bill, and there are a number of provisions in both the House and Senate bill that override the ERISA preemption and are very clear that it also applies to self-insured plans, and that's where we'll find relief. The federal government and again, I don't want to be partisan, but on the Democratic side, understands that the ERISA preemption has been simply too broadly interpreted by the courts, and what they're trying to do is be more explicit about what self-insured plans have to cover.
Would you say that for those of us that are in Illinois, we have self-insured plans, do you recommend trying all kids or iChip? I don't really know what iChip is, but...
Well, iChip is if somebody cannot get coverage from a conventional insurance company, then iChip is supposed to be the insurance option. And iChip would cover many things. iChip, of course, is prohibitively expensive for many people. It is the Blue Cross network. Most kids children have moved from iChip to All Kids because the cost difference is so significant. But the difference is All Kids provider network is the Medicaid provider network. So it's a little bit different. But All Kids does cover, I would encourage you to look into All Kids because, not just because of the cost, but it doesn't cover based on diagnosis. It covers based on the recommended treatment.
Faye can help you answer those types of questions. Yes, Green, and I saw.
My question did relate to iChip, and you mentioned All Kids. What about the equivalent for older individuals? What is the All Kids mechanism for adults? And who manages it, and how is it funded?
iChip is the only alternative.